Welcome back. In this video, we'll be getting to better know the symptoms in our cognitive group, specifically ADD, ADHD, and autism spectrum disorder. We'll be looking at how to observe, question, and manage the expectations of clients with any of these symptoms, and we'll begin with the attention deficit disorders. There are three different types of attention deficit disorders. The first is inattentive. Typically, when someone is referring to ADD, they are referring to inattentive ADD. It is marked by easy distractibility, forgetfulness, and an inability to complete tasks or pay attention to detail. The second type of attention deficit disorder is hyperactive, also known as ADHD. It is marked by a lack of impulse control, inability to sit still when required, and hyperattention to certain tasks. Now, the third type of attention deficit disorder is what we call combined or mixed ADD, which is marked by inattention, hyperactivity, or impulsivity. While it is helpful for you to understand the differences in the attention deficit disorders, it is equally important to understand that all three can be improved. Clients with ADD or ADHD have experienced improvements, such as an improved ability to focus, study, or organize. Many of the symptoms we have looked at so far are found on a large list of symptoms that define the autism spectrum disorder. ASD is so broad and so challenging to diagnose, it is important to understand that it is not your role to diagnose ASD at all. Your role is simply to identify the symptoms that direct neurofeedback can help. These can include anxiety, ADHD, insomnia, clinical depression, and seizures. Direct neurofeedback drives improvements in the symptoms of autism spectrum disorder. The client's autism spectrum disorder can improve overall. This concludes Module 2. In our next module, we'll take a look at one of the most important meetings you'll ever have with your client, the first one.